Saint Lucia's wounded healthcare system is on the verge of exhaustion due to the unrelenting COVID-19 pandemic. The year-long plus slog and pitch battles with the deadly, constantly changing virus have placed a suffocating grip on the health system. According to Director of the Owen King EU and the Victoria Respiratory Hospitals, Dr. Alicia Eugene Ford, medical staff are feeling the crushing weight of fighting to save lives, only to see patients rapidly slip away.
It does take a toll on them. They're working hard. We are going beyond the call of duty.
The burden on the health system has been both psychological and financial. Chief Medical Officer Dr. Sharon Belmar-George says free care, testing, quarantine, isolation and vaccination all come at a hefty price.
It has been exorbitant because a lot of the services that were provided to the public for COVID was provided free of charge. The isolation, the quarantine, the testing is another ridiculous cost. The cost of a PCR is about $150 US per test, and we provide that free of charge to persons who have signs and symptoms. So do the math. It has come at a ridiculous cost because we've had to increase staffing complement, resources, and also divert some of the resources from other important areas as well.
So, is the ongoing free healthcare for COVID-19 patients a sustainable option given fiscal constraints?
For public health measures, we always look at the cost of implementing the measures and the cost of not doing it. Given the impact of COVID-19, the preventable measures, the cheaper measures always come first to have it in a more cost-effective way. So it makes sense to leave testing, for example, to leave clinical care for COVID-19 free of charge, because if someone gets sick and they don't have the funding, the cost of a lot more persons getting sick from them not knowing their diagnosis would be a lot worse in terms of the impact of the country. So at this point, we would recommend, given the nature of this infectious disease, that the services and the testing and those remain free of charge to the public.
The cost of free care also includes services like oxygen therapy.
The oxygen therapy is very important for the management of COVID-19 cases.
To offset the heavy burden on the health system, Dr. Eugene Ford says the respiratory hospital has moved to further strengthen its capacity.
We've recently registered 15 Cubans who are healthcare workers. Under the Cuban bilateral agreement, we have registered them. And as a result, we are working along with them to familiarize them with our processes and our work processes. We've received a few staff members from the Owen King European Union Hospital to join on the team. And the Ministry of Health, which is our parent ministry, have been engaging or employing individuals who are not clinical, but are porters and domestics, etc., ancillary staff, which would allow us to work better.
Saint Lucia has only been able to amass vaccination coverage of 16% of the population, with PAHO labeling the island's vaccination rate as one of the lowest in the region. Solange Alfred, HTS News Force.